I've stayed kind of just like in my social bubble of like work friends.
I was getting kicked out of here. I'd be grabbing a group of buddies and going back to my place.
Now since the cases are rising up again, like I'm sort of a little scared again.
There's a saying, age is nothing but a number, though in a pandemic, how old you are could increase the chances of getting more severe symptoms. And that is putting pressure on younger adults. Cases are rising quickly in young people. 65% of the new cases reported in Ontario today were in people under the age of 40. With health officials concerned about the spread of COVID to older people, Dr. Theresa Tam made a special call out this week to young adults.
This is your generation. This is your time. You've got this.
All right, joining us now to answer some of your questions, Dr. Susie Hoda, an infectious disease specialist, and Dr. Samir Gupta, a respirologist. And we have some questions via video, and the first one to you, Dr. Gupta. Listen to this.
Can you tell us just how accurate or wrong is the idea that young people are less likely to catch COVID? And if they do, is it usually a less severe case?
It's really hard to know about susceptibility in different demographic groups, largely because they have different exposure patterns. There were some data from China early on in the pandemic that suggested that young people may be less likely to catch this virus, but it may also have been influenced by the fact that they often have asymptomatic disease, so we may have been missing cases. But it is true that they are less likely to get sick from this virus. So they're less likely to get symptoms. They seem to have less severe symptoms. And we know that they're less likely to be hospitalized and they're less likely to die from the virus.
All right, next question to Dr. Hoda, a viewer writing in. Is it possible the COVID-19 virus is mutating into a version that is more prone to attack young people, the 20 to 40-year-olds?
Well, I guess I'll start first with the whole concept of mutation of viruses. So we know that viruses mutate, and they do that, and most of the time it results in nothing that's of any significance. The good news is the virus that causes COVID-19 infection doesn't appear to be rapidly mutating, and not in any way that has really shifted its ability to infect people more easily or cause more severe illness. Or kind of shifted away from significantly from what it initially was, that it might actually compromise vaccine development. So I haven't seen anything out there that suggests that it's mutated in a way that is targeting younger people more than older people. But, you know, the point is that scientists are going to continue to monitor those kinds of changes.
Yeah, but you know what? What we do know to this point, as you describe it, is a little comforting, because a huge, significant mutation by COVID-19 right now, I don't think we're mentally kind of prepared for that. Dr. Gupta, here's a video question from Dylan Labont.
We're seeing cases in young adults spike, and a lot of people seem to blame this on younger people gathering despite public health advice. Conversely, this generation also has a large majority working in entry-level, front-facing service jobs. Does this not inherently put them at more risk? Put simply, is there any scientific data that can explain why cases in young adults are spiking?
This is a really important point being made, and there's a sort of narrative around young people being irresponsible and selfish and partying, but there are many other reasons why we're seeing an increase in case, particularly in this younger demographic. And the points that were made are very accurate. In fact, when we started opening up, it was young people in our service and retail industries that had to go back to work. So they were more likely to be exposed, and they don't necessarily have the luxury. They don't work the kinds of jobs that you can work from home as much. And they don't necessarily have the savings to ride out a pandemic like this. The other factor is that young people are much more likely to be cohabitating. So they might be in, for example, a dorm where they're going to have more exposure. So there's a lot more to this story, and there are many other reasons, including more exposures that they're having in their jobs and their day-to-day lives outside of this narrative around partying and going to bars, et cetera.
Yeah, really, really interesting answer. Dr. Hoda, next to you, and it's another viewer video question.
Hi, I have two daughters who are at different universities. Each of them live with 4 or 5 other girls. As hard as it is for this age group, they are all doing their best to keep within the advised social distancing protocols. Keeping in mind the numbers are going up in the 20s age group demographic, my question is, what is the recommended advice for testing university students who have maybe widened their social circle, and should they be tested before coming home?
Well, I'm really glad to hear that your daughters are trying their best to do the physical distancing and, masking and other public health and infection control measures, because really those are the most important things for them to be doing. Testing's a bit challenging. Right now, most areas of Canada are trying to reserve testing for people who are symptomatic or have been, clearly exposed or at high risk because of the kind of occupation they have or the kinds of things that they do in their day-to-day life. And university students might fall within that group. But the challenge was using testing to decide what you do, like should you go home, are you safe to go home, is that it really just gives you a depiction of what's happening at that point in time. So an individual could be incubating a virus, test negative, feel reassured by that, and then come home and visit, but then go on to develop symptoms and could potentially infect others. So again, it comes back to doing your absolute best to keep the physical distancing, mask, clean your hands, and follow the directions of public health that will keep everyone safe.
All right, Dr. Hoda, Dr. Gupta, we really appreciate the time you're taking with us. Thank you.